All right, guys, with Dr. Eric, the fitness physician, and today we're going to chat a little bit about some hot topics around metabolism and hormones. I think it's always interesting to get kind of both sides of the equation. So, what doctors are seeing in the space, especially functional health doctors who are trying to be mindful of not just avoiding disease, but health optimization. I definitely think Dr. Eric kind of falls into that category. So, Doc, what if you were to sort of break this down for us and we look at kind of conventional medicine versus what you do in terms of health optimization, or when people say I'm going to see a functional doctor or functional reference range health optimization, like what do those terms mean both to you and in terms of like what that should actually mean for a client and what they're looking for?
Yeah, that's a great question. Hi, everybody. So it's a more kind of hitting it from the preventive side, and as you mentioned, functional medicine, health optimization. They're similar, somewhat different, and it can depend. I'm kind of hitting it from the front end. I used to be see people at their worst in the ER. Take care of people at their worst. So my goal was to kind of prevent those things from keep people from getting in that bad condition or developing a metabolic disease, diabetes or high blood pressure, whatever that may be. So I think traditional, like functional medicine, you think of naturopaths or chiropractors or even family doctors or who's done additional training in functional medicine, they tend to focus more on, again, just that, the preventive side, maybe more focused on the gut and herbal remedies and natural products and things like that. Some of them do hormones, some don't, some do get into other things as well. What I do is more of along the lines of the classic, what used to be called anti-aging, but we kind of call it more like age management medicine or hormone and health and performance optimization. So we do all those things as well. Our main focus is metabolism, health and fitness, and hormone optimization, peptide therapy. It may even involve things like stem cell therapies, exosomes. But I also get a fair amount of patients who have those gut issues, and I have to do a lot of, and I definitely do a lot of natural products, herbal products, advanced testing on the gut and things like that, like they do in the naturopathic world. So it's a little bit of a blend. So, and I think more and more people are savvy to that, of kind of learning a little bit more about that, about how they can prevent things, and by tuning up their diet and maybe doing a few little natural products or tweaking their hormones, they can prevent themselves from getting put on pharmaceutical medications or getting surgery or having a life of infirmity. So I think it's catching on.
Yeah, I love that. And there's definitely something to be said about that preventive side of things. And a lot of people who reach out for nutrition and fitness coaching are also part of that crowd of trying to be preventative and take control of their health, or at least delay the aging process a little bit, or feel their best, look their best, be a little bit more confident with where they're at. And I love that you mentioned kind of so many different avenues. What I tend to see is a lot of the folks who are, they're already very health conscious, they're already exercising a lot, they're following some type of diet, probably like the chronic dieter, if you will. And they're really, while they're in that preventive medicine category, they're not necessarily like the overweight, obese, folks that may be categorized as something like lazy, or these people aren't trying. They may be a smaller subset of the population that's not obese, but they certainly have health conditions. And a lot of times with conventional medicine, I feel like these people are told that they're healthy, but maybe under the surface, there are these adrenal or gut or thyroid issues that they're dealing with that have kind of manifested as different symptoms. Maybe they're cold, maybe there's issues with going to the bathroom, constipation, hair loss, lethargy, fatigue, issues with recovering from the gym. So how much of that are you seeing where it's like someone who's clearly passionate about health and fitness, or they're passionate about their fitness, but they're not necessarily truly healthy from an internal health perspective based on the stress or tension or load that they're applying to their body repeatedly without adequate like recovery resources, whether that's from nutrition or otherwise?
Yeah, I see that a lot, actually. I get obviously a lot of people who are not in the best of condition. They want to get better. They've got some minor health issues and they want to get it better and they want to lose weight and they're tired and fatigued. But I've got a lot of people who are just exactly that. For example, I've got two pretty elite nutrition fitness coaches out on the West Coast, and they're on their game. They know it, but they know that they need to take it to the next level. So they came to me through a mutual friend, and got another gentleman who's actually probably a couple decades older than me in awesome condition. But again, he wants to make himself stay that way. He doesn't want to get slow down. He wants to see if there's anything he can do to make himself even better. So it's the true optimization. And I think the difference is normal versus optimal. And you mentioned that too. Like, people seem to be taking good care of themselves, but might be just a little bit off, or maybe they go to their doctor, they get some lab work, and they're kind of quote unquote normal, but it's not optimal. There's a big difference. So just going from a C student to a B or an A student makes a big difference, right? You're still passing, but there's a difference. So by just nudging them up a little bit further, we're not going to turn anyone into a superhuman or anything, but by nudging them up, it can make a world of difference. And those are the people, like you mentioned, they might be a trainer or a coach or a nutritionist, and they're pretty good, but they just need that extra gear. They're in fourth gear, but they can't get the fifth. So I do that. I've seen that. I take care of a lot of those folks, and it's amazing the difference. You've probably seen that too. So that's very rewarding. And those are some of the best patients because they know and they'll do it.
Yeah, a lot of the folks are working hard and they'll run themselves into a wall or run themselves into the ground almost. And that's where reverse dieting or understanding like we need to sleep more, we need to recover more, maybe even train less. And we're actually getting more results out of it's counterintuitive, where it's not necessarily conventional wisdom when it comes to eat less and exercise more. And the truth is that people can only do that for so long before maybe we see a downregulation in thyroid hormone or something like that. And you mentioned, you kind of piggybacked on some of the stuff I was talking about earlier with functional, optimal versus just kind of healthy. If you had to say some of the most common things, like for me, what comes to mind is I see, maybe a little bit lower free T3, a little bit higher TSH, maybe testosterone is not quite where it should be. Those are kind of the things to me that pop out where maybe they're in you're not diseased range, but they're not in like here's where you're going to feel your best range. Would you say that that's something that is true in terms of what you see in practice and with those folks who are maybe, really pushing it on the exercise front and maybe under recovering?
Yeah, definitely. And I think you touched on it earlier. And I think the biggest thing is the symptoms. And that's where the clinical experience comes into play. And, your knowledge with your clients and my knowledge with my patients is that, really tuning into those keywords that they're saying. They may just say a couple minor things on their symptom score that clues me in that I need to look into something. And that's way more important than the lab work. But oftentimes, as you mentioned, the lab work can be just slightly off. And that's where the nuances of hormones and metabolic markers come into play, because your typical testosterone mill, they won't look at that. They're just going to do one or two things. That's it. Where they're all like a stack of dominoes, and you nudge one little thing, it can affect many other little things. And you have to know what that pattern is. So a lot of people are, as you mentioned, overtrained, and so I see a lot of stress responses, a lot of adrenal issues, cortisol issues, and of course that's closely tied to thyroid. They go hand in hand. When one's off, usually the other one is off too. And as you mentioned, if I look at their thyroid panel, might be just a smidgen off. Again, it's in the normal range, but it's trending in the wrong direction. And then I tie that together with their history, and that can clue me in to pick up on something that probably would have been slipped through the cracks. So you have to be cognizant of that.
Yeah, that's awesome. So I have a couple of follow-ups to that. One is kind of your favorite way for testing with cortisol, because I know there's kind of some debate around salivary, serum, all that stuff. If people are going to have that done. And then my other question was, I feel like there's a connotation around thyroid and metabolism that, well, hypothyroid or Hashimoto's or these conditions are primarily female conditions. And I know for autoimmune disease, it is a little bit more common, but I think there's some misconceptions around like, well, can guys have hypothyroid? And I don't think people realize how common it is where low T or hypogonadism and hypothyroidism kind of can go hand in hand. So I'd love for you to talk about, okay, so if cortisol is tied into this, how are we testing for that? And then is it true or false kind of, that both genders are experiencing this, or is this primarily a female issue? Because I know a lot of guys just associate everything kind of with T. They don't really think about their thyroid, but that can be a really big determinant in how they're feeling, in other areas where you mentioned symptoms. I kind of talk in terms of biofeedback.
Oh, definitely. And I see that a lot too. And that's what I mentioned earlier. Like a lot of times people go to these little men's health clinics and they're just looking at, like you said, they're just looking at testosterone. That's it. Well, oftentimes you have to look at a couple steps upstream on the hormonal cascade to find the problem. And again, everybody's stressed out. I see, a ton of cortisol stress issues. And sometimes that's the problem. People focus on, say, testosterone or this, but it's like, oh, no. We just need to back you off, adjust your, fix your cortisol. And oh, wow, magically your testosterone gets better. It's funny how that works. So
Right.
They go hand. Same with thyroid. Yeah. I mean, it is more common in women, certainly, especially when it's autoimmune, like Hashimoto's, thyroiditis, and things like that. But men get it too. I just saw a patient last week who had a very abnormal thyroid symptom and score, and it definitely happens, especially with the stress response. So it's men and women both, because they can be affected by not just stress, but toxins in the environment, micronutrient deficiencies. As you know, we're overfed and undernourished in today's society. So if you're not getting some of those important vitamins, your iodine, your selenium, your B vitamins, your vitamin C, different things, it can affect a lot of things, even if you think you're eating healthy. And a lot of people are, but they're still getting a toxic burden. And then you add on, some missed sleep and some stress, and it just kind of pushes the the last little flip. It's the last nail in the coffin. So yeah, I test those things. I do a lot of screening just with blood work, which of course is just a snapshot in time, but can still be is still very helpful. And I'll repeat that as needed. But we'll also do some more comprehensive testing, especially for things like the adrenals and cortisol and things like that. I like the Dutch test, for example. It's a good screen. It gets a multi-point score of saliva and urine throughout the day, usually 4 or 5 samples throughout the day. And it checks it as a diurnal rhythm throughout the day, and it checks all the metabolites of your hormones. So that's probably the best test for cortisol. One of the few things I get salivary tests for. For some of the other hormones, it's not as good. The serum or dry blood is definitely better, but I definitely like to use those saliva and urine tests for the cortisol response. You can look at the cortisol awakening response. You can look at the rhythms throughout the day and all the metabolites. So those are pretty cool as well.
Yeah, the metabolites are awesome, and Dutch is definitely good on the adrenal side. And then some of the female reproductive hormones and seeing different pathways and metabolites and stuff can be really cool with the urine testing. Salivary is kind of convenient for some folks, and doing those 4-point, like getting that circadian rhythm or diurnal rhythm can be very insightful, because if you're having a hard time sleeping, or you're not getting that adequate, melatonin response later in the day, or you're not having cortisol awakening response in the morning, yeah, you're going to feel fatigued in the morning, and you might be wired and tired at night. And those are kind of that classic inverted rhythm that we experience so often, and when it comes to lifestyle. And that's why when people, look at training and nutrition, and then, or even, medicine, and then all of a sudden we're talking about routines, like, hey, do you have a morning routine, or what's your evening routine like? What's your stress management like? And I think sometimes people just sort of fail to connect the dots there, and sort of view fitness as this silo. Well, I go to the gym for an hour and I eat healthy, and then that's separate from like every other aspect of their day. Same thing I kind of see with hormones, and that was going to be kind of my next question, is when it comes to hormones and physiology and all these different things, I do see outside of the functional space, a lot of people put them into their own little buckets or categories. So it's like, well, testosterone's over here, and that's your androgen or your anabolic, and then thyroid's over here, and that's going to be related to hypothyroidism and metabolism. And then maybe it's like gut health over here, and then maybe adrenals over here, not realizing, well, if we have elevated cortisol, that's going to influence, free testosterone and some of the biofeedback we're having there. It's going to impact our thyroid hormone conversion in terms of what's happening with how much metabolically active thyroid hormone are we left with. So how much do you see that in the space of, like, there are doctors out there kind of just view it in isolation versus the totality of the symptoms? And, from a lifestyle perspective, things that patients and clients should sort of be paying attention to.
Yeah, I see that all the time. And I think sometimes patients, when I'm talking, they come in with like an agenda, like, okay, I want to fix this, doc. I just want this one thing. Like, guys, like, what's my T, man? What's my T? They just want to know. I'm like, dude, hold on. It's more than that. And I delve into like you mentioned, the lifestyle. I ask them about the two biggest things I always talk about first is the 2 S's, sleep and stress. And those are huge, because if you don't fix that, I don't care what, I could give you the magic potion and you're not going to get results. So I definitely delve into the sleep and the stress. Then we talk about nutrition, we talk about fitness, and then I get into the hormones, and then we talk about other stuff too. So yeah, I think a lot of places will go to, well, I see this guy for this and this guy for that, or my doc talks about this, but not that. So I see piecemeal all the time. So I try to like synthesize all together. That's why I love working with other professionals, whether it's a clinician or a trainer or a nutritionist, whoever like yourself, who has a good knowledge base of everything. You can put all the pieces together. Yeah, I need to refer out to this, to the doc for this, but I can give you some general framework. And same with me, I can give you some guidance in this area, but I'm going to send you to my nutritionist for this, or whatever that may be. But I feel comfortable, again, just talking about all those things. And it's, I always tell everybody, it's like the gears of a car. They all have to fit, nutrition, fitness, supplementation, hormones. They all have to jive for that gear, for those gears to spin. And that's why I talk about it all. And when I explain it that way, they usually get it. It makes sense.
Yeah, I think that's a great example, right? Because let's say someone is provided or prescribed a mix of thyroid hormone medication. If you're not addressing that stress issue, maybe if there's some gut stuff going on, adrenal stuff going on, we're in a position where they're not even going to really reap all of the benefits from that thyroid hormone. or if we have something with like testosterone and you're not necessarily managing levels of body fat. I've seen way too many guys who will be put on TRT, but because they didn't manage the body fat, they're having a lot of issues with aromatase and higher estrogen levels. So I totally agree with the gears analogy. I think is perfect. And you mentioned sleep and stress. I actually just posted this today while we're having this conversation. I use the acronym SHRED, so sleep, hunger, recovery, energy, digestion, and stress, with obviously those bookends, sleep and stress, fitting right into some of the things that you were talking about. So completely agree when it comes to biofeedback, and I really like the gears analogy in terms of that integration between everything that's going on.
Yeah, and I could even take this a step further. I mean, and that's the problem with today with, Dr. Google, and everybody on the social media is an expert and everything, right? You'll hear podcasts and people talking about, who I've been interviewed by some of them before. It's like they talk to a doctor, they talk to whoever, and get some ideas. Then all of a sudden they're the expert instantly, and they start spouting off ideas. And you can actually do harm with some of these things, whether it's a peptide or hormones, if you don't really have the education and training. Because I've seen that where people will go to a protocol, and all of a sudden they're getting worse. And they're like, well, I don't understand what happened. And they don't understand what happened. The person they went to, and I talked to them, and I'm like, I'll tell you what's wrong. They didn't do this first. Like you mentioned, stress and thyroid, or stress and testosterone. Peptides are another example. If you're giving someone a certain peptide and they're inflamed, or they have a gut issue or something else, you can do some harm. You can make them tremendously worse, not just feel bad. You can really mess up their metabolism. So you kind of have to do things in a certain pattern and a way of fixing it. And that's where that holistic picture comes into view. So yeah, I mean, definitely if it's all interconnected, and there's a kind of a method to the madness of how you do it. It's not just a cookbook of, oh, okay, give them tests and give them this and give them that. Like, you see people doing that all the time on social media. I'm like, no. There's way more to it than that. Just like I wouldn't walk into a cockpit and I read the manual. Okay, I can fly a plane now. Hell no. You can't just read a couple books and some studies and all of a sudden you're going to practice medicine or be a trainer. It just doesn't work that way.
Yeah, and I love the example that you gave with, peptides, and we had some conversations offline around some of that. There's a great episode with one of the pharmacists from TaylorMade. If you're interested, I definitely would encourage you to learn from pharmacists or physicians like Dr. Eric when it comes to some of these protocols and stuff. And it really does echo, while it's different, obviously coaches are not going to be prescribing within their scope of practice, the layers by which you might attack a problem. If you don't address inflammation, if you don't address adrenal issues, if you don't address thyroid issues in your coaching practice, you're not really going to get to a place of aesthetics and body comp and fat loss. Like, it's going to be a lot easier for that person to lose weight and for them to have a sustainable and basically maintainable physique, versus if they kind of walk in and they just want fat loss right away, but they have all these internal health issues and inflammation. So the same way that Dr. Eric might use medication to sort of work through this, or maybe he addresses the inflammation first and then layers on these different protocols, it's kind of like what we would be doing on the training and nutrition side. Well, if someone maybe has a pre-existing condition, maybe I need to pull out some inflammatory exercise and include a lot of walking. Maybe I need to tweak the resistance training a little bit, maybe modify lower intensity cardio versus that super like HIIT or interval work. Get some of that inflammation with, improved food quality and monitoring what they're doing and how their digestive feedback is, how their digestion is overall. And once you start to make progress in that area, it's really going to help you see results a little bit faster when it comes to that fat loss or muscle building, because you're not constantly fighting this battle with these root issues that people are dealing with. So I kind of love that, the way that you kind of explain that. And some people don't, I think, understand those underlying factors, or maybe how, cortisol does connect to inflammation or the adrenals, or how gut health ties into inflammation, or, well, what is this whole thyroid conversion thing that we're talking about? So I really like that you did a little bit of a deep dive into that as well.
Yeah, and it's kind of a behavioral and professional thing too, right? So I mean, we get a lot of trainers who will send us patients exactly what you said. They're doing this, they're eating their train, but something's missing. We'll fix the hormones, we'll fix the metabolism. Now they're getting more results. Now they like me. Now they like their trainer, and they're going back to us, both of us, because they're happy and they're getting results. Same with me. I'll send someone to a trainer to get that extra gear, and now they're happy with both of us. Obviously that helps that they talk, they enjoy both of us. It gets everybody happy. Everybody, gets business. Everybody's busy, but it makes, the important thing is that the client gets results and they're happy. And I think it's a behavioral thing too, right? I had this with another trainer I'm working with, and obviously we're, as guys, a lot of guys are we're kind of bullheaded and sometimes, just don't want to listen. It's kind of like when I talk to my kids, hey, take the trash out. Hey, take the trash out. Hey, you have to hit it multiple times to get them to do it. Guys are terrible at that. So if they hear it from the trainer, they hear it from the doctor, and they hear it back and forth. And instead of just one of them, they're like, okay, yeah, he did say that too. And that's where it's awesome that, you're diving into that with your clients. Say, hey, you may have an adrenal issue, blah, blah, blah. I suggest you go see, the doc and talk to them about this. That seed is playing in their head. Now when they see me, they're a little more receptive. And then when I send them back to you, we're going to tell them the same thing. We're on the same page. And they're like, okay, everybody's telling me that I'm going to do it now. So sometimes it just takes that little behavioral push, that repetition, and that can be very helpful. Otherwise, they may not do it. You know what I mean? So that's great to be on the same page. And I think that helps our patients and clients tremendously.
Yeah, and it makes sense given that it takes so long. I mean, a lot of the people we're working with, they're adults and they've formed these habits over the course of several decades. So sometimes they need to hear it more than once, and that's totally okay. And hearing it from multiple angles, people learn differently. So there's definitely a lot to be said for that, and in terms of clients actually absorbing things and taking them to heart. So I know in terms of today, we're trying to keep it a little bit shorter. So Dr. Eric, I don't want to keep you too long, but would love for you to share a little bit more about like where people can grab some resources from you, Instagram handle, all that good stuff.
Yeah, thanks. Appreciate it. I'd love to do it again. Maybe, we talked about doing a podcast and another one of these. DrEricPrimex.com is my website, DrEricPrimex. I'm on Instagram, Dr. Eric, the fitness physician, Dr. Eric Primex, the fitness physician, I believe is the tagline. I'm on Instagram, on Facebook, and the website again, Dr. Eric at DrEricPrimex.com. So thanks. That was a lot of fun.
You do some YouTube and stuff too, I think.
Yeah, I've got a bunch of YouTube videos out too. Again, I think it's Dr. Eric Primex, the fitness physician, I believe is the tagline. If you search it, it should pop up.
It's a combination of all your keywords. You just got to pick the right ones and you'll end up in the right place eventually.
Right.
So, all right, guys. Well, appreciate you spending time listening to us today. Definitely enjoyed the talk on functional medicine, all things kind of metabolism and hormones with Dr. Eric, and we'll talk to you soon.
Thanks, Sam. Thanks, guys.